Hi, I'm Dr. Alison Kole, sleep medicine specialist and bona fide chronic insomniac. Welcome to the Sleep is My Waking Passion podcast. Remember, knowledge is empowerment, and if applied correctly, it can help you biohack your way to a better night of sleep, just like I did. Hello, and welcome to the Sleep is My Waking Passion podcast. You know who I am. I'm very excited today. I have Dr. Shelby Harris. You have probably seen her on the Today Show and all sorts of various social media platforms. She produces a lot of great content, so I highly suggest that you go and follow her because you will learn a lot about sleep. So, Shelby, please correct me if I say anything incorrect here, but sure. She wears many hats from what I can tell. I think it's so great that you're a clinical associate professor at Albert Einstein. Mm-hmm. I think that's huge. Are you actually doing some teaching regarding sleep? Like, do you teach the med students?
I did a lot more routinely because now I'm more volunteer faculty, but I do a lot of consultation. I still teach the graduate students or the interns in psychology and sometimes in neurology. So I still have my hand in there, more supervision and consultation. But when I was there, I was like full on supervising constantly.
That is amazing because first of all, you know, what I can say from my exposure was that we didn't talk about it. It was like one of those things you didn't talk about sleep. You just never, it was not important. It wasn't anything on anybody's radar. So it's huge that, you know, you were so involved with that. And probably some of the smartest folks that ever came out of training all came from Albert Einstein. Like one I can say. I have so many of my really smart friends.
Wonderful institution. I am so honored to have been a part of it and still be a part of it. And the neurology department there is just beyond amazing. So I'm very lucky to be there.
So cool. So cool. Yeah. Oh, by the way, she also happens to have her own private practice. So she's the director and founder of the New York Sleep and or should I say New York Sleep and Psychology, not the New York and Sleep and Psychology.
New York Sleep and Psych. Yeah.
So if you want to have a consultation with her, you should check out her website. She's got all the links that you need to get in touch with her. I was going to ask you about sleep diaries and stuff. And I was like, oh, I see a sleep diary. Let me look at this. It was great. She also, as I mentioned, is a huge social media advocate as well as director of sleep health at Sleepopolis. So I was looking and I was like, wow, this makes complete sense. It's sort of focusing on different types of mattresses and everything. That's what I got from the website.
Yeah, they do a lot of mattress reviews and also just like pillows, but also just sleep education as well. And they practice what they preach. They want like people who are actually educated in what they're talking about, teaching and medically reviewing things. So I do a lot of social media stuff. I do a lot of interviews for them. I do a lot of content for their website that's like legit. So it's a really good place to go if you really are just
because especially since I've definitely been looking at mattresses and I can say part of it's like you just don't even know what to believe, right? Yeah. So it's like you're hearing, oh, well, we've done these things, but then you look at the fine print and it's like, well, actually they sort of like paid us and all this and all that.
But the other thing to consider too is that like, I don't know about you, but I was never taught about how to pick a mattress and the right pillow and bedding. Like they don't teach that in graduate school for psychology or for sleep medicine. That still isn't something that's so well taught. So I have learned so much from them, just like how does someone test mattresses? What are the different constructions? Like I've learned so much in that area that I think it's all gelled together pretty well.
Yeah, and I can say there's definitely different strokes for different folks. Like some people need that softer mattress. I'm more of a harder mattress, firmer mattress kind of girl. And you never know. So yes, you've got a new resource, guys, which is super cool. So Shelby was gracious enough to donate some of her time to me because she, as I mentioned, has been really very well versed and talked a lot about some of the different sleep pain points that people have. And so what we were going to try to talk to you guys about today was sort of try to see if we can unpack a little bit some practical ways to treat certain insomniac sleep styles. That's what we're calling it today. So Shelby, I think if I wanted to talk about anything, it would be what happened to me last night, which is the busy brain.
Yes.
So there was the Chiefs game. It was great. Hung out with my husband. There was we did not do a whole Super Bowl party. I think I maybe had like one beer or something during the thing. So nothing that should be horribly impacting my sleep. And I just ended up waking up in the middle of the night. I didn't look at my clock, so I can't tell you exactly what time, but it was sometime in the middle of the night. And I was like, oh, here we go. This is perfect because it's happening literally right before we're going to tape this. And I really, it was hard to get back to sleep. And I'm going to share with you what I did, but I was curious, what advice do you have for our listeners and what seems to work for your patients and your experience?
Well, the first thing I always give as advice is I say, you know what, a night where you wake up in the middle of the night, does not a problem make, right? So sometimes it doesn't feel good, but it doesn't necessarily, the more that we worry about it, the more it becomes more of a chronic issue. So I try to first thing first, always try to normalize what healthy, normal sleep looks like, and that it's not perfect every single night. Then on top of that, then what are the things that we're doing in the middle of the night that could be worsening our ability to go back to sleep? You can't necessarily force sleep to happen aside from possibly drugging yourself to sleep. If you're not sleepy, you're not sleepy. There are things you can do to set the stage, but don't always have that be so attached to the outcome of I have to fall asleep, because that only makes it worse. So the whole idea of if you're anxious, if your brain is busy, getting up, going do something just to pass, it's more to pass the time so you're not forcing sleep to happen and getting more anxious about it in bed. And I like people to stay away from the screens, mostly because it gets us sucked into other stuff that then keeps us awake even more in the middle of the night. So I'm a fan of listening to a podcast, reading, something I have a lot of patients that are doing paint by numbers recently for some reason.
Oh.
Easy crossword puzzles, things that aren't going to necessarily get stuck in your brain and then make you want to stay up. So finding things to do is a really useful thing just to pass the time.
And if I recall correctly, you had also suggested something that I think works. I just, I can't say that it works in the middle of the night, but maybe before you go to bed, which is that whole concept of brain dumping.
Oh yeah,
just
for sure.
Putting your, things that you're worried about on paper.
Yeah. So there's different ways to do it, but I often will say, if you wake up in the middle of the night with stuff on your brain, it's usually there right before you go to bed. It's just sometimes you're so sleepy you can override it. But if you haven't taken kind of stock and looked at it, it's going to pop right up when you've now alleviated a little bit of that sleep pressure. So if you can do something like either journaling, a worry time, which I talk about in my book, if you want to just do a to-do list, something, there's different ways to do it, but just get things out of your brain, figure out, can you do something about it? What's the next step you can do? And if there's nothing you can do about it, work on practicing a bit of acceptance and moving on. That's a huge thing. Those are all things that can be really helpful for that busy brain in the middle of the night.
I love that. And have you had any folks that tell you, oh, really, I can be, okay, so if I can't go to sleep, then I can do stuff. And then they start doing maybe some things that might not be the best. I've had folks be like, I'm going to go downstairs, I'm going to do the dishes, I'm going to start doing laundry. And I'm like, I just feel like that might be a bit too active. So I try to encourage them to do things that are a little bit less active. But have you found that really impacts anybody?
I don't really, it's interesting. I don't really find one way or another that it makes a huge difference. I think it really does depend upon the person. One of my friend and old mentor, Michael Perlis, he's a big insomnia researcher, but he used to always say if you want to go and bake a cake in the middle of the night, it's fine, go do it. It's just so you're not lying in bed, associating the bed with anxiety and frustration. It'll pass the time. And if you don't fall asleep, guess what? The next night you'll likely sleep better. And that's kind of how he looks at it. One of the worst things I think people will often do, and I've seen a lot of sleep physicians actually recommend this, which I really don't agree with, is they'll say, go outside and try to find something that makes you bored. And I actually don't like that. Because then the more that you're trying to force boredom to happen, if you don't expect yourself to get sleepy, you're actually putting more pressure on yourself. So I always say, find something to pass the time that's mildly enjoyable, that just doesn't make you then sit there thinking about why you're not sleeping. Because if you're sitting in the dark trying to make yourself bored, you're going to only think about why you're not asleep, and that just makes it worse.
Well, I will say what seems to have worked for me, which is, because this happens to me periodically, I've definitely had issues with this crazy brain. It's been much better since I don't take call all the time and all of that, is I signed up for Mind Valley. And there's all sorts of things, YouTube, etc. Some of it doesn't, but I'm going through this program to do energy work. This guy, Jeffrey Allen, talks all about energy work and all of this. And really what it is you're just quieting your mind. You're paying attention to how energy is flowing. And however you look at it, it's meditation in a nutshell. It's saying you can slice it and dice it any way you want. I've even done hypnotherapy on YouTube that you can just listen to. And it just helps you take some deep breaths. It helps you, I think, with that sort of selective body relaxation. So you're sort of going head to toe and sort of gradually relaxing your body. And that seemed to really work for me. I was like, oh, okay, I could re-engage with sleep. And I was able to stay in bed for that because I was able to fall asleep within 30 minutes.
That's
but
great.
To your point, often if it's beyond 30 minutes and I'm still staring up to I got to relocate because then I'm just going to be mad. And then I'm like, I know I'm telling my patients to do this and I better get my butt up and do exactly what I just said to do for sure.
Yep, I agree.
You know, and I'm wondering if you've had this too. I read a study that was kind of cool. It was looking at folks that some of them reflected on past events versus some people who actually made a list that was more about the future. And it was the people who sort of dumped about the future that really had the most positive impact on their sleep. So perhaps if you're dealing with some old baggage, journaling about it might kind of rev you up if you're doing it right before bed. So that's just another food for thought. You might want that list to be more futuristic, potentially.
But the thing is, when we think about anxiety, and that's usually what is impacted, that impacts insomnia a lot for a lot of people. Anxiety is really about worry about what you can and cannot control in the future. It's really a very future-oriented thing. So it totally makes sense why something like that was beneficial for those patients.
Yes. And to your point, kind of learning to let go. And I will say, guys, that I have embraced the whole concept of meditation like during the day. And for me, I really try to do it in the morning and then kind of right before I go to bed. And I don't make it long. I don't have hours in the day to do this. I'm like 10, 15 minutes. And just that habit, and also not judging myself. If my mind's like, this meditation really wasn't good today. I have about 500 things in my brain. But like my friends have told me, screen door, just let it pass right through you as much as you can and not judge yourself. It's okay. Because it's like normal to have a bazillion thoughts in a day.
For sure. And meditation should never get easier. If it's getting easier, then you're doing something, who knows what you're doing, or maybe you're not actually meditating. But what is meditating? There's no perfect way to do it. And there are going to be days that it's easier, and there are going to be days that it's more challenging. And that's kind of the point of it. So you got to stick with it.
And now a quick break, but don't go anywhere. We'll be right back.
Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleeping coach program, suspect you have sleep apnea, or simply seek a second opinion, she's available for consultations in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 15-minute consultation today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted physician.
If you are liking this podcast, if you're finding it educational, if you are feeling more empowered to go to your doctor with any sleep issues that you might be having to address them, please, please, please lend your support. Make sure that you are liking, following, subscribing. I am available on YouTube. I'm also on Apple, Spotify, wherever you get your favorite podcasts. The website has launched. So we have AskTheSleepMD.com to be your free educational resource. We've added many new blog posts filled with juicy information. If you would like to support the podcast, we now have a way for you to donate. This is a labor of love. I truly enjoy what I am doing. It would be inspiring and truly helpful if you wouldn't mind even so much as donating $1 to keep this podcast going, particularly if you really find this free education a good platform for you and a good resource for you. I also have affiliate links for products that I'm a proponent of, such as Quiet Mind. So please check out the website, sign up, and you will get the latest news, the latest blogs, some sleep tips, and just have a great day and keep listening. Okay, guys, sleep well. What else have been real pain points for your patients or for your clients?
Perimenopause issues are a big thing too. So, because that's a lot of what I deal with. I think just the room, partner sleep is a really big issue, especially in the perimenopause range. So there can be, a lot of my patients will complain that they have someone in their bed who's snoring, either they're snoring or the other person's snoring. Their temperature debates, because they're waking up, a lot of times the patients that I have, with hot flashes, night sweats, and then they wake up with that busy brain again. So really working on trying to figure out partner sleep issues, and then how can you kind of come with compromises or figure out when should you be trying to sleep together versus sleeping apart. So that's a lot of what I deal with too.
Wow. So I would say that my experience has been, I've had so many patients who may be on the second relationship and the first one didn't work out. And sometimes I'm like, I wonder if it's because you were making an awful lot of noise and now you're with the new new partner and you're like, oh no, I want that to work out. So now I'm willing to try. Like I'm willing to talk to you about my snoring and all of that. I've definitely had, especially for my male patients, that's definitely been something that I've seen for sure.
Yeah, but that's, I think, a big one that I see a lot is like when it comes to the perimenopause stuff, it's just like people's bodies are on fire. They want to have a certain temperature. The significant other doesn't want that temperature in the room. There's a lot of just moving noise. It's all that stuff is it really creates a lot of tension in the family.
So if I read correctly, I think you had suggested, you could consider like different style comforters. Like somebody has a thinner comforter, sort of like you can still be together but separate. And one of the things that Morgan Adams had mentioned to me was, I guess she has a partnership with 8 Sleep. And I know there's other companies out there, but the idea of having some sort of a mattress cover that will like, you could set it so that it will keep you cool, especially if you kind of have a tendency to run hot, which happens in perimenopause. Have you had any success with that? I've talked a lot about it. I haven't had anybody actually use any of it.
No, I've had a lot of patients. There's a few different brands on the market, but some patients do swear by it. Yeah, for sure. It can make a big difference, especially if there's not such an easy way to change the temperature in the room, or you are someone who's having hot flashes. Like that's something that for some people, it really can be a game changer.
How have you been able to get them to kind of calm the hot flashes? A friend of mine, Dr. Val, had mentioned that there's some data that really shows that kind of a cognitive behavioral therapy approach seems to work like super well, which I don't know why I was so shocked by that, but I was like, really?
We don't fully know why it works that well. but yeah, like there is data showing. I mean, I talk about it in my book a lot. There wasn't that much data at the time. There's more since then. But yeah, CBT actually does help with the hot flashes and interesting, like more than you would think. So that's one option. And then, like there's a lot of stuff out there, whether it is hormone replacement for some people, and that's a conversation that needs to be had. For other people, it could be sleep apnea that's worsening some of this stuff. So there's now other medications that are specifically for hot flashes at night. So there's definitely a lot of options out there. And I think that the old idea of like, you should just like wake up in the middle of the night and put your head in the freezer just to cool yourself off. We don't need to do that anymore. We have so many more options to help people. You shouldn't suffer.
And I think you're highlighting a really important point, which is we're paying more attention to us, to women, and what we need to do. Because before it was just like, oh, that's just something that women deal with and just be quiet. And what we know is that we don't complain. And the problem is we don't complain. And then there may be actually really serious consequences to ignoring all of the perimenopausal symptoms, just being like, okay, well, you're just something you just have to, it's just a stage of life and you just deal with it. Too bad.
Now, I always say to people, I say that you are the expert on you. And if you feel like something is off, if you feel like something has changed, if you feel like your sleep is not restorative, find a doctor who will listen to you and take it seriously.
Oh, that's such great advice. Just don't stop. Advocate for yourself.
If something is wrong. You know if something feels different.
Totally. I was going to ask you about, I have had some patients and sometimes there's trauma behind it. Sometimes you can't really pinpoint what it is, but like these sort of hypervigilant patients, some people are like the littlest thing they'll wake up and it's really hard for them. What have you found really works for them?
So for the really like very light sleepers, I think there's a few different things. One of the things for a lot of them, it could be something like they're in bed too many hours. So like a simple little modified sleep restriction can actually make a huge difference. So sometimes like a little less, like 15, 20, 30 minutes less in bed and being consistent with your sleep-wake timing can deepen your sleep a bit more, that you don't wake up to stuff as easily. That I find honestly works the most for a lot of people. Then other things could be things like if you are really sensitive, you could think about a white noise machine if noise is something that easily awakens you. We think about the size of the bed because that's stuff that could definitely awaken someone. Noise canceling earplugs are another really big one. And then other stuff like just even meditation, like we were talking about, practicing some mindfulness during the day, not even 10, 15 minutes, like seriously 3-4 minutes. If you start with that can help to just kind of quiet the brain down a bit so that you're not always kind of scanning the environment for certain threats. So that's another really big one that most people don't think of for lighter sleepers, but I actually do find that it tends to help people a little bit more now.
Oh, that's awesome. I sometimes will also, like if I know the patient sort of describes that they don't feel like their environment is that safe, or like they don't really love their neighborhood, I'll be like, all right, like what are some things that would make you feel safe? Like, are there things that we can is it worth it to invest in an alarm? Do you go and be a little OCD about triple checking the locks or doing what have you? Like, how can we make it so that environment feels safe for you?
What can we modify and what can't we? And I always try to pinpoint all the things that we can. And that's a huge one. And then even on top of that, there are some people who do have a bit of a trauma history or more trauma history and have nightmares. And so there are some people who've had issues and they're scared to go to sleep, that their sleep is very light because they're always kind of looking out, or they're having a lot of nightmares that's causing them to fear sleep or awaken more. And that's other stuff that we want to address with nightmares or any sort of trauma issue that might be causing that lighter sleep.
Yes, definitely, guys. Don't be afraid to reach out and really speak with a professional, especially if they have some expertise in nightmares and PTSD and those types of things, because, man, I trained at the West LA VA, especially vets. I mean, a lot of them are. Talk about hypervigilant. Wow. It was really nice to learn from Jen Martin. That was my sort of mentor.
I know, Jen.
Oh, God. She's such a sweetheart. And anything I know about CBT is because I would stay in sessions and just watch her sort of wave her magic wand, if you will. Really being very dogmatic about it, but getting through, which is so hard, especially with that population.
For sure.
I think another type of personality, if you will, that I've seen, I'm definitely guilty of this, is being a little type A. So kind of learning to be kind to yourself and sleep is not kind of that task that you have to get accomplished. It's more like, listen, you can have your goals and you want to achieve everything, but then it's almost like their sleep is worse because they're reaching for perfection, if you will.
Yeah, that's a big issue. I work in the New York City area.
Probably a lot of business folks and high stress environment.
A lot of very high achieving patients who really they are able to, for better or worse, control a lot of aspects of their lives. And something that's so basic as sleep feels like something that they should be able to control. When in reality, you cannot control sleep. You can control all the variables around it as best you can, but you cannot control whether your body is just going to magically fall asleep. So that's really the biggest thing that I work with a lot of them is trying to let go of control, because this idea of optimizing everything is actually making it worse for a lot of people. This idea of perfection. And I say a lot, perfection's the enemy of good when it comes to sleep, for sure. And so we really want to work on trying to let go of that aspect of perfect control. I got to do this. I got to do that. And then that will help to slowly kind of let sleep happen a little bit more naturally, because the more you just kind of obsessive about it, the worse it's going to be.
Do you think because of that, they may be super or overly hardworking, if you will, and they may be putting in some of these folks? My understanding is they can put in some really crazy hours that may just be unreal. In the expectations, you go home and now I'm ready for sleep so I can optimize it. And it's you need downtime. You're human.
Yeah, I see that. Yes, a lot of times I'll see patients who they'll work 100 hours a week and then think that they're so exhausted they should just be able to crash right away. It doesn't really work that way. And having worked in hospital, at Montefiore in the hospital system there for a long time, I've had physicians, surgeons say to me, how can I trick my body into needing less sleep? How can I trick my body to just go right to sleep? There is a biology that's set in here that just the modern professions haven't adjusted to over time, or our bodies haven't adjusted to it. So there's a bit of needing to have a cushion. And if you can't find time to even having a cushion to wind your brain down, then that's a bigger issue of what's going on in life.
This has been such a cool discussion. Shelby, I do want to ask you to talk about your book, because I looked at your website and everything, and I was remiss. I did not know the title of your book. So I want you to talk about it, because it sounds like there's so many juicy tidbits in there.
Oh, thanks. So I signed the book deal in when I was 9 months pregnant with my second. I have two kids, my second child, because I thought I'd have extra time on maternity leave, because I'm a fool, right? You think I would have known. So when I was thinking about what I wanted to write, and I was very fortunate. A publisher kind of reached out to me at Norton Books, and they said, we want you to write a book. And I was like, I want to write something about CBT for insomnia. But they said to me, well, what sort of population? Let's make it a little bit more specific. And I said, you know what? I work a lot with women in various age ranges, but a lot of perimenopausal and menopausal women. And at that time, there was some research out, but there wasn't a ton of research on it, which is really kind of crazy. That wasn't even 10 years ago, right? So I really thought about it, and that's really what the book is focused on. So it's the Women's Guide to Overcoming Insomnia, Get a Good Night's Sleep Without Relying on Medication. And it's a workbook about CBT for insomnia focused on women. And even in the book, I talk about hormone replacement as an option, but it wasn't even then as outspoken, people talk about it so much more now. than they did back then. So there's definitely, it's got that kind of CBT framework, but it talks about women and unique challenges that parents have and during pregnancy, I talk about that aspect in various stages when people might want to modify. It's not to say that you can't use medication with it, but it's a nice option for a gold standard treatment to help people sleep a bit better.
Oh, that is so cool. Yes, guys, check it out. This has been super fun. I just wanted to ask you one last question because I'm curious. Have you found, because obviously there's a downside to sleep technology, but I was curious if there's any sleep technology that you have found sort of useful as adjunctive to the classic sleep diary and the things that we do to try to optimize folks' sleep.
So it's interesting. So a lot of the trackers in the New York area, I find it is making insomnia patients more obsessed about their sleep. So I really actually am like, put it away. But I do find that they have their place for some patients that I'll get once in a while who are like falling asleep left and right, but it's because they're sleep deprived out of choice. I'll use it in those cases to help highlight how sleep deprived they are. That's not insomnia, it's insufficient sleep issues.
Got it.
I actually do like the trackers more because I came from the world of actigraphy, right? So I've been using those for ages. And I actually use them a good amount with either like kids and teens where we're just not getting a good census to their circadian pattern. I like them for giving me an idea as to like if they're a night owl, if they're an early bird, stuff like that, so then I can know where to go with treatment.
That is so cool. Well, thank you, Shelby. I know you have to get on to your next patient. This was super fun. I'm so glad we got a chance to connect.
Thank you for having me. It was my pleasure. Thank you.
Of course. Disclaimer. The statements made on this podcast have not been evaluated by the U.S. Food or Drug Administration. They are not intended to diagnose, treat, cure, or prevent disease. The information provided by this podcast should not be used as individual medical advice. While I am a practicing sleep provider, I am not your sleep provider. You should always consult with your personal healthcare provider for individual recommendations and treatment.